I work at Ward 1 at the Mount and I'm one of the new nursing associates. I've been at the Mount for just over 5 years now. Started off as bank and then after a year again the trust had a recruitment drive.
I've been involved in working with associates for some time now. We've had people in a variety of different roles over the years, associate practitioners, technical instructors, dietitian associate practitioners. And a number of years ago we got the opportunity to be part of the nursing associate pilot, training up to 10 nursing associates.
I just came into post just as a pilot. The first individuals had actually qualified as part of that pilot. So really exciting times.
The government rolled out this new nursing associate training and luckily our trust was one of the trusts accepted to start the first cohort and luckily got on the course, and I think there was about 10 of us from the trust.
So we started off with really small numbers, so we had a group of people working as associates in our older people's wards, and they really showed us what the potential was of those roles, and so we've increased year on year, and now we're actually training more associates than we ever have done before, and we want to continue that. We know that we need a really diverse workforce working at all different levels. But what's really great is there's a career pathway now for our staff, so they can come into the organisation and do an MVQ, get some experience, and then go on to be an associate practitioner. And then from that, they can actually go on to be a registered practitioner.
I've worked in the trust for over 32 years. I used to work at Hyroids, and then when Hyroids closed, we went into community hospitals within the community, and I used to work looking after dementia patients, and after 10 years that closed, and I was asked whether I would like to come to the Mount. I've never looked back since that. We were the first cohort to actually applied for the associate practitioner.
We know that we need a really diverse workforce, so we're continuing to think about how we can use those roles, and we're looking at having particular cohorts working in particular areas. And there's a real diversity of roles that people can be involved in. We employ them in lots of different roles across the organisation, in our community settings, in our inpatient settings, and some of the roles are focused around professional groups like the nursing associates, where they're part of the nursing pathway. We've got generic associate practitioner roles, where they can work across the whole of the multidisciplinary team.
We went to Leeds University, did a year. I remember my first shift as an associate practitioner. Nobody knew what we were about, what we should be doing, and we basically had to make the role our own.
Although there was some confusion, I think, with staff around actually where they actually fitted in within some of the service areas, so we did quite a big piece of work around actually what the skill set was. But for me the greatest skill is that they've got physical health skills, and I think working in a mental health organisation, that's invaluable, because we all know that people who actually present to us which are unwell don't necessarily just have a mental health issue, they can also have some physical health conditions as well.
It was lots of physical intervention, example like the wound cares and blood pressure, the Muse, and we've never looked back since. I think the role got more and more demanding as management realised what we were about, what we were capable of doing. On the ward, what we do, we take on the lead for the physical health. We update care plans, update face risk, but always under the direction of a qualified nurse.
We're now taking on a lot of like the physical health stuff. A lot of my training out at Leeds Uni and on placements was around physical health, so it's been great to bring that to the ward in the similar things for pressure sore management and wound care. For me, I think it's sort of been that bridging the gap between the nurse and the support workers, and maybe it's quite similar for Colleen as well. To differentiate, for me, I will do medications. So that will be one of the main parts of my role. But again, also like Colleen was discussing around updating care plans, risk assessments, making referrals, and also working with other professionals in the team. So being in like multidisciplinary team meetings, a nursing associate will not run a shift, but they can help coordinate the nurse. So a nurse may delegate me tasks to do during the day to then enable them to do more of their nursing. And then also I could be like a second qualified. And so when the first qualified will be coordinating, I can go out and do medications.
I think nationally we're probably at the forefront of planning around nursing associates and associate practitioners, and I think we've done a lot of investment, a lot of time and energy into those individuals because they are the workforce of the future for us. And I think for me it's really exciting because I'm really proud to be the Director of Nursing, but I'm the Director of Nursing and Professions, so that means allied health professional groups as well, and so we really do need to consider the workforce of the future, and now that will look very, very different.
And we're also looking at the potential to work with one of our local universities to develop a mental health associate practitioner role, which is something that's never been done before. And that means that we can tailor the training specifically to a mental health setting. And so that might be that there's a really clear role for an associate practitioner with mental health expertise rather than having that generic or physical health. So that's a really exciting prospect. And we've also developed a preceptorship programme specifically for associates, and then we're also thinking about how we support them beyond that so that they achieve their full potential.
And I suppose as part of our wider workforce plans, we haven't just looked at our qualified nursing, what requirements on each ward and each setting. We've actually looked at our skill mixed staff and our associate practitioners and our nursing associates, because it doesn't necessarily have to be a qualified nurse or a qualified professional that undertakes everything in the workplace. So it's made us much more focused on actually the best person to deliver the best care.
The training was hard at the time, but looking back now, I've had no regrets at all. I love what I do. I mean, it is challenging. It is a big responsibility that you've taken on, and but I have no regret, and I would recommend it to anyone.
Well, for me, I want to be like one of like the first advocates for the nursing associate role, and hopefully through the trust be able to do that. And like Colleen says, I have no regrets at taking on this opportunity.